Hi everyone, it's Lisa with livingwithasthma.net, and we're back with another of our Asthma House Calls where we get to sit down and talk to some of the very best doctors and other health professionals who treat asthma. Today we're here with Dr. Robert Reinhardt, an expert in asthma, allergy, and allergy testing. Dr. Reinhardt is the U.S. Medical Director, ImmunoDiagnostics, ThermoFisher Scientific. He's also an Associate Professor of Family Medicine at Michigan State University. Thanks for being with us, Dr. Reinhardt.
My pleasure. Thank you, Lisa.
Now, I think the big question on everyone's mind with allergies and asthma is, why do allergies play such a significant role in so many kids' asthma, and are there risk factors for allergic asthma?
That's a great question. It turns out that as many as 90% and at least probably 80% of children have what we call allergic triggers to their asthma. There are various kinds of asthma triggers, and allergens are just one of them. Some other common ones are things like cold weather and anxiety and irritants. But allergic triggers are arguably, along with infectious triggers, the most important ones for children's asthma. So again, this is hugely common, 80 to 90% of children having these allergic triggers. For adults, it's also a big number. It's probably more like 60% than 80 or 90%, but allergens and allergic asthma are very common and very important chronic disease problems. You asked if there are risk factors for developing allergic asthma, and certainly one of them would be genetic or family history. We know that patients who have the genetic likelihood to be allergic, that runs in families, of course, and there is certainly a genetic aspect to this problem. Other risk factors, the most important one, and we'll talk quite a bit more about it, I suspect, would be exposures. We know that to become allergic to pollen or a pet or a food or whatever kind of allergen it might be, you can only become sensitized and possibly allergic if you're exposed to that allergen. So you won't be allergic to weeds and trees and grasses in some region where you've never lived and been exposed to them. You may or may not be allergic to pets if you've never owned pets, because some people get exposed despite the fact that they don't own them. So this exposure factor is key in terms of being at risk from, and as we'll talk about, I'm sure, preventing difficulties with allergies, and in particular allergic asthma.